in Berlin, in Germany, in Geneva, Switzerland, and everywhere around the world. Welcome you to this joint virtual press briefing with His Excellency Federal President Frank-Walter Steinmeier of Germany and WHO Director General Dr. Tedros H.E. A word on the procedures. We will start with the opening statements and then open the rooms for questions. Very happy to have you all here. Handing over to Berlin.
Ladies and gentlemen, a very warm welcome. Almost a year ago, the World Health Organization categorized the outbreak of COVID-19, a pandemic, an infection that spreads globally. Today, we have to state that this pandemic will be with us longer than we had hoped at the time, and the necessary restrictions are testing our patience and our nerves. With the spread of more infectious mutations and variants of the coronavirus, the pandemic has now entered an especially critical phase. The virus is adapting. That constitutes a major challenge, but mankind too has learned something new and has made progress in fighting the pandemic. To begin with diagnostics, treatments, therapies that have been developed further, but above all, with regard to the development and manufacture of vaccines that have become available much speedier than we may have expected and hoped for 19 months ago. We all know full well that governments are first and foremost, and understandably so, committed to their respective publics. In our society, we feel that general sense of impatience. People are expecting of us that we deliver vaccines more quickly in order to allow them to return to an open social and economic life. But although we may be focusing on our own public these days and weeks, on the situation in our respective countries, we must not and should not lose sight of the international dimension of the pandemic. It does make sense to protect these particularly vulnerable groups, not only in your own country, but also globally. From a health policy aspect, but also from an economic and above all moral aspect, it is thus important to guarantee a fair and equitable global access to vaccines and to diagnostics and therapeutics and drugs. And this, if possible, before the healthcare personnel and workers is affected by the pandemic itself. The good news is, ladies and gentlemen, that at an early stage of the pandemic, and thanks to the courageous and energetic commitment and engagement of, above all, the European Union, capabilities and capacities were united and structures were created that allow us to pursue a global strategy to combat the virus. The ACT Accelerator, a platform coordinated by the WHO, is a genuine milestone in international health cooperation. The rollout of the vaccination activity via the COVAX facility has begun with the delivery of the first 330 million doses to 145 countries. Of course, the suffering is immense in many of these countries, as is their sense of impatience and the frustration not to be given access to vaccines speedily enough. And thus, people are a bit concerned about the inequity when it comes to access to vaccines. Thus, it was important to me to talk to some of the players of this unparalleled cooperation and to remind all of us of the international dimension of the pandemic. Allow me to expressly thank the WHO, its Director General, Dr. Tedros, all organizations that are involved, their staff, for their untiring commitment and engagement, be it through vaccinations, tests, or therapeutics and diagnostics. Your commitment saves lives globally, day in, day out. Whether and how convincingly this cooperation is successful will be a litmus test of international solidarity. The funds that have been pledged by the members of the G7 last week are more than just a good signal. Germany, too, has made a substantial contribution in this regard. Other countries in the world are called upon to follow suit in order to provide the necessary resources to the ACT accelerator. All the resources we need, resources that, of course, are but a fraction of what the restrictions are costing us and have been costing us over the last months or so. But when we are honest to each other, this is not only about funds and money. In the weeks and months to come, doses of vaccines will continue to be a scarce good before we are able to ramp up production and make it work at full speed. The more speedily we in Germany and Europe are willing to share what has been secured, the better will we be able to reduce the infections globally, the better will we be able to protect ourselves against the risk of new and more dangerous mutations and variants. It's not going to be easy, but it is a question of humanity, and it is also a question of our own yardsticks and standards. And at the same time, it is in our very own interest. What is at stake here is the question, and what kind of world we want to live after the pandemic. If we refuse to grant the necessary solidarity, we must not be surprised if other countries come in to fill this vacuum by delivering earlier what is required and using that for their own purposes. The pandemic constitutes a geopolitical moment which will have enormous consequences for our own future, the future after the pandemic. And finally, only if we succeed in acting as a global community to combat COVID-19 successfully, will we be able to set about facing up other global challenges, such as man-made climate change, with a new sense of optimism and in an effective manner. This is why the efforts and the untiring work undertaken in and coordinated by the organizations in Geneva deserve our full support. Thus, it is also important for us to listen to our guest and to hear him describe the world in times of corona, viewed from the standpoint of Geneva. And thus, I'd like to hand the floor to Dr. Tedros. You have the floor.
Thank you. Thank you so much indeed. Vielen Dank, Herr Bundespräsident, for your kind words. And thank you so much for your leadership and partnership. As His Excellency said, we have just had a very constructive discussion about the global response to the COVID-19 pandemic and about how we can strengthen the relationship between Germany and WHO even further. Germany and WHO have had a strong relationship for many years, but that relationship has become even stronger in recent years. I very much appreciate the leadership of Federal President Steinmeier, Chancellor Merkel, and Minister Spahn during the pandemic and their support for WHO and for global health. Your support has given us as WHO inspiration and energy. Vielen Dank indeed. Thank you so much. Last year, Germany contributed more than $600 million to WHO, including more than $430 million to support the COVID-19 response. Germany is also the largest donor to the WHO Contingency Fund for Emergencies, which enables WHO to respond rapidly to emergencies. Germany was one of the main drivers behind the formation of the Access to COVID-19 Tools Accelerator last year. That was designed as an end game to this pandemic and has continued to be a leading advocate for solidarity and equity in the global response. We very much appreciate Germany's announcement of 1.5 billion euros in funding for the multilateral response to the pandemic, including the ACT Accelerator at the G7 Leaders Summit last week. I also admire that Germany has been learning its own lessons from the pandemic. All of us have to learn from it. This pandemic is unprecedented. And I welcome the announcement by Chancellor Merkel last year that the government will invest 4 billion euros by 2026 in strengthening Germany's public health capacities. President Steinmeier and I also had a very good discussion about ways to strengthen WHO and global health security, including the International Treaty on Pandemic Preparedness and Response that has been proposed by Charles Michel, the President of the European Union. I would like to use this opportunity to thank my friend Charlie. This proposed treaty would provide the framework to strengthen collaboration between nations and people. We also discussed ongoing plans to establish a WHO Center for Public Health Intelligence and Risk Analysis in Berlin, which I agreed with Chancellor Merkel last year. So, Your Excellency, vielen Dank once again for your leadership and your partnership. We very much appreciate it, and we look forward to continuing to work with Germany and very closely in the months and years ahead as we respond to the pandemic and work together for a healthier, safer, fairer world. Again, thank you so much. Vielen Dank, Your Excellency.
Thank you so much, Dr. Tedros. And now I think we are expecting questions.
Thank you, Dr. Tedros. Thank you, Mr. President. Ulrich Steinkohl, DPA. The first question, please. Mr. President, you mentioned in your statement that the prosperous nations are to share some of the doses that they have promised to poorer countries. The French president has proposed that that be 4 to 5% as quickly as possible. Should Germany follow suit, also do so quickly as possible, and even at a time where we don't have enough vaccines here in Germany? And a question addressed to Mr. Tedros. At the G7 summit, pledges were made of billions of US dollars, but we tend to realize that this doesn't necessarily mean that this is immediately translated into vaccination rollout. What has to happen in order to ensure that the vaccines get to the poorer countries? I think the realization, the understanding is there. Everyone heard Dr. Tedros say that fighting the virus in one or but a few countries does not suffice, that we will only have overcome the virus if we've overcome it everywhere. No one is safe, he said, until everyone is safe. If there wasn't general agreement on this, I think the whole COVAX Act Accelerator initiative wouldn't have come about. And as Dr. Tedros just pointed out, there is a great readiness of many of the participating countries to do so. And allow me also to make the point that the fact that the United States have returned into the fold of WHO is indeed a major contribution here. Fighting the virus successfully has to be done in a global manner. Think of the mutations, the variants that have appeared of late. They will also return to our countries if we don't make our contribution to ensuring that the pandemic is fought in all across the globe, in other parts of the world too. So the readiness and the awareness is there, also the willingness to make available doses of vaccines. But you hinted also at the funds. Funding is necessary. We haven't got sufficient funding yet, but that is what we need. Funding itself do not constitute or do not immediately translate into doses of vaccines. You made that point. This is why we have initiated a debate at the European level about when the European countries could be and should be in a position to make available to countries that have no access to doses, make available to them a certain amount of the doses they have at their disposal. When this will begin in concrete terms and the exact amount, that is something we are talking about and discussing amongst the governments involved. What is decisive, though, is that we do not lose sight of this international dimension. And it is important that we note that we're not only talking a moral or development policy aspect of the matter. What is decisive here is that we realize that the self-interest of the countries in the Northern Hemisphere has to make them ensure fair and equitable access to vaccines, diagnostics and therapeutics for countries in Africa, but also in South and Latin America. As for the rest, as I said, we are engaging in a discussion about that amongst at the level of the respective governments. Germany and France have taken up that debate, and I welcome that. Dr. Tedros, you have the floor.
Yeah, thank you. Thank you so much, Your Excellency. And regarding the second question, first of all, I would like to thank the G7 countries for their contribution. Of course, the pledge is significant and it will help us to vaccinate as many as possible. At the same time, I would also like to tell you the challenges we're facing. We have discussed this with His Excellency, the President, very, very candidly. Even if you have the money, if you cannot use the money to buy vaccines, having the money doesn't mean anything. I explained to His Excellency, the President, about some high-income countries who are actually approaching manufacturers to secure more vaccines, which is affecting the deals with COVAX, and even the amount that was allocated for COVAX was reduced because of this. And we can only have vaccines delivered to the countries who are members of the COVAX if the high-income countries cooperate in respecting the deals that COVAX did. And before they ask any manufacturer for additional vaccines, to make sure that whether their request undermines the COVAX deal or not. But I don't think they're asking that question. And that's why one thing that I would ask the high-income countries is, before they ask the manufacturers or the private sector for additional vaccines, they should make sure whether their request affects the COVAX deal or not. Starting vaccination in all countries is in the interest of the whole world, because it can help us fight the virus everywhere. If this virus is not defeated everywhere, we cannot defeat it globally. It will have a safe haven somewhere and can strike back. Even if some places are left and are delayed in terms of vaccination, they could be the breeding grounds for new variants, and even the vaccines we used may be out of use, meaning we could be back to square one. So doing the vaccination everywhere, taking the public health measures everywhere same time, it's in the interest of all countries, including high-income countries. When they undermine that and they only vaccinate their own population and the rest is left, it's not only a problem for those who are not vaccinated in the developing world, but the problem is also for the high-income countries. So I understand there is local politics here, because all politics is local. And they should respond to their constituencies, to their voters. But at the same time, they should speak to their constituencies saying, the best way to protect you is not only to vaccinate you, but vaccinate the rest of the world, share the vaccine with the rest of the world, so the globe can be, the world could be better protected, and we're safe at the same time. So that's what I would like to say. Money, okay, having the funding is good, but it's like, having the money, but you can't buy anything with it. Means it doesn't mean anything. So we have money, but we should also buy vaccines using the money. And I think the high-income countries should really understand that. They should understand that, okay, we're giving money, but are the vaccines going to be delivered soon? And is vaccination starting soon in the rest of the world too? Okay, I give you money and then it's up to you if that's the issue. That doesn't help. So we give money and we make sure that vaccination starts, makes it complete. It's not the money or it's not the vaccines. At the end of the day, it's the vaccination that matters. And it's not about equity only. It's not about sharing only. Sharing, morally important, but it's also about protecting the whole world, about making the whole world safe by attacking the virus everywhere, same time. Thank you again for that question. Thank you, Your Excellency.
Thank you very much. With this, we call upon the first journalist out of the UN press corps in Geneva, which is Laurent Sierro from the Swiss news agency. Laurent, please go ahead.
Yes, I think you can hear me now.
Here we go.
Yeah, thank you. And a question to President Steinmeier. The schools reopened this morning in a majority of lenders in your country. How important will that be to solidify the social fabric in order to tackle the pandemic? Thank you.
Have you all listened and heard the question? It's about reopening schools in a majority of Länder in Germany and what effect that has on the attitude of the population regarding the pandemic and the efforts to fight the pandemic. You reported about it, you wrote about it, that general desire, understandable desire of many families and children, last but not least children, to reopen kindergartens and schools, primary schools. Perhaps in the direction of Geneva, we should say we don't have a flat, a blanket regulation. We have federal states in Germany, and I think we have 10 of those states now that have reopened schools this morning, primary schools and kindergartens, that is. All of that is carefully monitored, evaluated continuously to note whether this creates additional risks. And on the basis of that, we will see other Länder following suit, perhaps take it to a second stage. But as I said, it's a carefully monitored process. To be honest, I think it is way too early to comment today about the attitude or to draw conclusions with regard to the social fabric and the attitude of the general population, because we will have to await for the developments of infection figures and numbers in the weeks and days to come. At the end of the day, it's not only figures or numbers that people look at. They not only focus on whether schools are being reopened or not, but what they want to do is to make sure that risks are predictable and manageable. They want to have a slow return to what we consider to be normal life. But whether that is possible depends on whether we can succeed in further reducing the numbers of infections in the days and weeks to come. A question to Miriam Pauli, NTV in Berlin. I have a question addressed to both of you, Mr. Tedros, Mr. Federal President. You spoke of the funds that have been made available for the procurement of vaccines, scarce vaccines, that is. Allow me to ask the following question. Did you perhaps talk about this today, or do you think it ought to be discussed more openly? To what extent the licensing of vaccines should be made possible, opening up patents, that is. And Mr. President, if I may, because you spoke of the risk of variants and mutations, that people are growing wary and tired of everything. So the tone has become harsher. It's been harsh quite for a while. Also, online, virologists and experts are being increasingly subjected to attacks. What kind of signal would you like to send out in order to counter that development and to urge people to keep their focus and not develop in a way that is not beneficial for any society? Let me respond to the first question, supporting WHO and COVAX. What I will take with me from our discussion this morning is that the COVAX initiative does not, want to achieve a 100% fair and equitable distribution of vaccines, but it departs from a realistic perspective, saying that we ought to strive, we ought to try to use the funds that have been made available to the COVAX initiative now to, especially or in particular in the poorer countries of the world, equip health care workers with vaccines, but also with protective equipment, for example. WHO has noted that all of these countries have extremely weak health structures. And if on top of that you have a spread of infection, placing an even greater burden and strain on the structures or making them incapable to function, you will be left with a country or countries where you have no one who is able to cope or to actually vaccinate people and treat them and save them. So it's a very modest demand of the COVAX initiative to first and foremost focus on healthcare workers in the poorer countries. Your second question, oh, yes, I remember, that was about the licensing and copyright. We have talked about this intensively, but I don't want to anticipate what Dr. Tedros would like to say. It is a question that is also being discussed within the WHO with good arguments in favor and against, but basically it's a question that is not really the remit of the WHO, but it is something that is rather the remit of the World Trade Organization, WTO, that is. And the new Director General, as you may have noticed in her very first statement after being appointed, spoke about the protection of intellectual property rights. Patents, said something that made me prick my ears generally, because it cautions us a bit to not simplify the discussion, which brings me to the problem that you mentioned regarding mutations and variants of the virus, because she said what we have to do is find a third path. The interest of public institutions and private companies has to be kept alive to invest in research and the development of drugs, medicines and vaccines. So the proposal some may have made that we just, have a kind of waiver for patents or a licensing, I don't think that this would be the right approach. She pleaded in favor of setting out on a third path, pursuing a third approach, and I am sure that Mr. Tedros would also like to comment on this. At least my impression has been and is that WHO too is quite aware of the fact that the most simple answers aren't always the easiest ones or the most effective ones, and that a third approach focusing on voluntary elements and contributions might be the best to pursue. But I, as I said, don't want to anticipate Dr. Tedros, who undoubtedly will speak out on this too. And your third question regarded the message that ought to go out from today. What I said only recently to the Bundesrat, the second chamber in Germany, is continuing to be important in a difficult situation, and we are undoubtedly in a difficult situation. We have to be careful not try to shove around responsibility between authorities within a country or authorities of different countries. The enemy we have to fight is not located in Berlin or in Brussels nor in the various states of the Federal Republic of Germany. The enemy we have to fight is the virus. And as the virus is adapting, is changing, is mutating, we will have to continuously adapt and change our measures to fight the virus. I said so at the outset. This isn't always easy at a time where impatience is growing and nerves are being daily tested. But when you take a look at the situation, you should at the same time also be confident that we will succeed in fighting the virus in the months to come. And we may be disagreeing about the right path to pursue, the right approach, the right measures that will allow us to return to normalcy. But let's not forget that other countries are a far cry from such discussions because they simply don't have any funds or means at all to even begin fight the health crisis and manage the health crisis. And many of the discussions we have here, whether BioNTech or the AstraZeneca vaccine is the right one to administer, is from the point of view of the countries that Dr. Tedros keeps talking to on a daily basis, is a luxury.
Yeah, thank you. Thank you so much. I think His Excellency has addressed many of the issues, so I will just add a bit. You know, on opening schools, our children, our precious, have actually lost a lot by staying away from school. And we recognize that, and that's why we're working with UNICEF and UNESCO to help the schools start. But not only education is important for our kids, but with safety too. We need their safety too. That's why we need to focus in addressing, you know, transmissions. We have to keep transmissions, especially community transmission, under control so they can start schools. Of course, this varies from country to country, and that's why UNESCO and UNICEF with WHO are trying to help member states to open up based on their local situations. But of course, we should do everything to our children. And then on the especially production, as you know, the COVAX facility's target is to vaccinate 27% by 2021, by the end of 2021. And as you also know, EU has announced that it will vaccinate 70% by the end of this year, or by summer actually. And the rest of the world is also interested to increase the coverage of vaccination so there is herd immunity as soon as possible to control or to suppress the virus. And if we're going to achieve this, then there should be a significant increase in the production of vaccines. And we have already started working on this. And one area is, as His Excellency said, what WTO and WHO are doing in relation to the TRIPS agreement related to intellectual property. This is unprecedented. Of course, this pandemic is unprecedented. Of course, as His Excellency said, some member states are in favor, others are not. There are still different opinions, but this pandemic is really unprecedented. We're having here in our hand a common enemy. And we have to do everything, including, the waivers on IP, to increase production so that the world actually opens up and moves into recovery. Because lives and livelihoods are at stake here. And everybody wants to recover from this crisis as fast as possible. So governments, manufacturers, all stakeholders should do everything to contribute for the world's fastest recovery. And that's why the work in WHO and WTO, especially related to TRIPS, as His Excellency said, is very important. And I would like to use this opportunity, actually, like His Excellency, to call on countries who have some concerns to cooperate and defeat this common enemy as soon as possible. And there are some models, for instance, that are starting actually to happen. For instance, companies can turn over the facilities to produce other companies' vaccines. Sanofi has done that for the BioNTech vaccine. And non-exclusive licenses could be other additional opportunity, and I can list actually more and more. So we have to do all the options, all the opportunities that we have in order to increase production. Because with increased production, the pie is increased, then there is, a better volume to share. Otherwise, with shortages, sharing is difficult. And that's exactly what's happening now. If we increase the pie, then better opportunities to share it equitably too. So I think these are the questions I would like to address. And again, thank you so much, Your Excellency, for your support, especially in the importance of global solidarity to stop this pandemic.
Thank you. With this, we come to the last question, and this will go to Geneva to Christophe Vogt from Agence France Presse, AFP. Christophe, over to you.
Hello, thank you for taking my question. I would like to expand on what you just said, Dr. Tedros, on the production and TRIPS, which seems to be a difficult thing to put into place. Did you have talks with pharmaceutical companies to help them find the capacities to produce more? Do you have anything in place where you can put two producers together and say, oh, you have a plan there? Is that something that WHO can do, something practical? And then a question to the Bundespräsident Steinmeier. Meine Frage war, wie kann der Staat zum Beispiel dabei helfen, die Produktion zu erhöhen von Impfstoffen? Kann man vielleicht, könnten Sie da auch helfen, die Koordinierung zu machen?
When it comes to coordinating activities, just one example. Thank you very much.
His Excellency, maybe? We can...
I think we'll start with the first part of the question, Dr. Tedros.
Okay, thank you. Of course, we're talking to the manufacturers directly, and we're encouraging them to do so. And I hope they will cooperate, because as I said earlier, this is very unprecedented. It's a pandemic that took the whole world, or that's already taking the whole world hostage. And the manufacturers too have social responsibility to stop it. So there are some positive signals, and we will continue engaging them and hope we will have a solution with their cooperation. Thank you.
Thank you. As far as Germany is concerned, I have not had the impression that we have not undertaken any attempt. We've done as much as we could, encouraging companies. More have not yet produced or have shifted it elsewhere at an early point in time. For these companies, it is not easy to begin producing here in our know that where driving up the production, Dr. Tedros pointed out, your question, the way you put it, also gave us an indication that there is such coordination ongoing. It is just as important, you know, when you aim to improve treatments and therapeutics and drugs. That is also an area on which research should continue to focus, and development activities ought to continue. We need companies' engagement on both aspects of the problem, of both areas. And this is why we have to make sure that we work to scale up production. Companies are working actively with our support, but very often this is also linked to the change of global production when it comes to pharmaceutical products and vaccines. One of the leading producers of vaccines and therapeutics is India. India's become one of these leading producers. The United States and Great Britain, for example, are closely cooperating these days with their partner companies in India in order to drive up production there. The companies will undoubtedly have to draw their own conclusions from this development and rethink whether the regionalization of their production has been sufficient, and perhaps they will have to do more on that front in the future. Thank you, Mr. President. Thank you, Dr. Tedros. Thank you to the colleagues here in Berlin. We put an end to our virtual trip to Geneva here now. Thank you very much.
Dr. Tedros, thank you.
Thank you very much, everybody.
Thank you very much.
Your Excellency, Director General, and to all attending journalists. With this, we are closed. Thank you.
Thank you. Bye-bye. Thank you.